My interest in medicine came, believe it or not, from art. I enjoyed painting, sculpting, and coming out of El Paso, Texas, I was looking for a direction towards art, and it took me to New York City. And I graduated from Columbia University, and from there, went into medical school in Philadelphia, and from there, I went looking for a practice in musculoskeletal medicine. So that was a cross between neurology and orthopedics. And that's when I found physical medicine and rehabilitation. And it seems to hit a lot of the bells and whistles I was looking for, a lot of hands on activity, but also appreciation for anatomy. And I got to use my sense of eye for art, looking at balance, symmetry, as well as understanding function. Had the intellectual interest of understanding neurology. So it seemed to be the perfect fit for me. Having said that, what led me towards physical medicine was those issues, but also learning more about procedures. And coming to San Francisco, I became a more proficient physician with pain intervention. Learned from really good people, Richard Derby and also Bjorn Eck in the Daly City, where they taught me a lot about pain intervention, how to examine individuals, how to know what technique would work with people, what doesn't work, and just trying to get better every day. I work with individuals from industry, and that could be with things as widespread as a motor vehicle accident involving head injuries, could also be with spine, could be with things with amputations. This could be with fingers, hands, toes, legs. So the spectrum is broad, and I try to use all my facilities to try to help individuals who are struggling and try to get closer to normalcy. They might not always get there, but I'm trying to get their destination realistic so it's not too far fetched for them to grasp. A lot of times it involves modalities of acupuncture, chiropractic, physical therapy. We try not to use a lot of medications and try to use intervention as a last resort. But I'm glad that I have some skills that I could provide for those last ditch efforts. I think the variety of patients that I get presented, it challenges me. And I want to help people not suffer. It's something that I could identify with in my own experiences, so I try to bring that to the table. I try to make people as functional as they can be within their framework. A lot of times, their industries can be devastating. It's not always a physical issue; sometimes it's a mental issue, and so I'm trying to be sensitive to that facet of their injury. So having to see people in a broad spectrum, not just a physical entity, but more of a conscious being, and trying to bring some humanity to their recovery. I think I start off conservatively with the general aspects such as therapy, acupuncture, chiropractic. I try to introduce medications at a later stage, but I try not to have people, quote unquote, hooked on medications. I let people have control of their destiny. I want them to be in charge of their lives so that they're not dependent on substances. And sometimes that also involves intervention. That could be either simple things in the office like trigger point injections. Sometimes it's also more aggressive things like epidural injections to relieve pain from the spine. Sometimes it's an intermediate where you're trying to regenerate tissue, which would be with platelets or stem cells or simple things like dextrose for prolotherapy. So Boomerang at this San Francisco facility is very fortunate to offer a lot of choices. I'm a physiatrist, but we also have an orthopedist on staff as well as a psychiatrist, and we interact as a team to try to give patients the best widespread service that we could provide. But sometimes this could also require a more intensive program, such as a functional restoration program. And this is a commitment that the patient has to definitely provide for us because it will be a 5 day a week approach for up to 8 weeks. But the benefits are really impressive. People change their lives, their mentality, and oftentimes they can have a lot of normalcy to their lives. I think getting involved with individuals who are trying to get better, it's really satisfying to have somebody who almost feels like they have no resource, and to show them that there's some benefit out there that we can give them and that we could provide, and as a team try to reach their goals with. So I try to get their expectations realistic, but having to reach these goals, most of the times I have a pretty good average in terms of helping people get there. And when you get there, it's a really cool feeling. You know, people are grateful. Sometimes they don't always see it, but you see it. And just to have satisfaction that you made their lives a little bit better. It's not always perfect, but if you can get them closer there, it's a pretty cool thing. So I'm based here in the San Francisco office 2 days a week. I do 3 days in Daly City for a separate facility, but I do essentially the same thing. I evaluate patients in industrial injuries as well as sports injuries. These are with musculoskeletal problems. Sometimes it's brain injuries, and try to give a multifaceted approach. I enjoy working at this facility. It's a well-grounded group that I work with. I have great support staff. It's taken a lot of trust working with individuals who have, I guess, shared their trust with me as well, and I try to not disappoint.